Good evening. Good evening. Honorable Deputy Prime Minister, Mr. Mudavadi, and all protocols observed. It's a pleasure to be with you here this evening, and I'll say just a few words. I was once in the diaspora, so I'm not a big stranger. I started at the University of Minnesota. I say 3 cold winters, and I'm sure you're also experiencing. You're just about to get your winter, not a long time from now. However, we are not here to talk about winters. We are here to just say hello to you and to thank you for turning up in such large numbers. We just come from a conference in New York, and it's a pleasure to have driven this far to come and see you. I was asked to say something very briefly about healthcare, so that when the Deputy Prime Minister gives his speech, then maybe you'll have answered maybe one issue about healthcare, and this was raised during our meeting in the coffee room, and that was about the adequacy of the healthcare system in Kenya, as well as the issue of insurance, for Kenyans, for healthcare. I think all of you are aware about Vision 2030. There are 3 pillars there. There is the political, there is the economic, and there is the social pillar. Healthcare sits in the social pillar, and there's a lot that is being done to ensure increased access to healthcare for all Kenyans. The National Health Insurance Fund now covers all civil servants, all teachers, all staff in the disciplinary forces, that is the police and the prisons, and we know that this is going to be extended to other Kenyans. So there's a beginning, and I think we need to appreciate any progress that we make as a country and anything that helps more Kenyans access healthcare. It's true that we need more nurses, and that was raised, that we could have a better training system that ensures that people are able to be nurse practitioners, able to prescribe, able to give medication. And I know there's always a good and a bad side to everything. Let us give credit to what has happened over over 40 years since independence, and also appreciate that we are a young nation. It takes hundreds of years to develop good healthcare. And if you look at countries where there's good healthcare, there's a history of training of health professionals for over 200 years. Kenya has been training doctors from 1968. And the nursing schools maybe a little bit earlier. So let us also give credit where it is. Currently we have 5 universities training doctors. The University of Nairobi, Moi University, Kenyatta University also has a medical school. I know we also have 2 others, and we also even have a private KEMU that is also training doctors. Nurses are being trained in very many institutions, and I agree we don't have enough. But the work is being done, and if there's anything that you can do to help increase that training, we welcome it. I know you are all keen to help, and I know that you will, in your own way, through policy formulation and through other ways, assist in increasing access to healthcare. So I think as we increase the number of professionals, we also need to improve the infrastructure. We need to have more hospitals, more health centers. But all said and done, I think there's hope. And some of you who are business people, I challenge you to talk about health insurance and help us increase the penetration of health insurance in our country. Only about 4% of Kenyans have private health care. That is very, very low. Opportunities there for you, investment there for you. Thank you very much. And if there's anything that I can say, I would say that just as Mr. Nyamoya said, I sit on the University Council. I'm the Deputy Chair of the University of Nairobi Council. I also am the Chair of the Alumni Association of the University of Nairobi, so any of you who are graduates of the University of Nairobi. And at one time I was the Chair of the Nairobi Health Management Board, so I know quite a bit about the public health sector. Currently Chief Executive of the current hospital, which myself and my husband, Dr. Gikonyo, founded 6 years ago. Kagwe, you are welcome. Thank you.
Regarding some very many issues that you wanted to ask, and the importance of the diaspora and where it is going to sit in future administrations. Now, for me, the place where you will sit as diaspora in future administrations will depend on the diaspora itself. And I don't want to preempt what the Deputy Prime Minister is going to say. But I just want to say this. Success begets success. Success begets success. The importance that is going to be given diaspora by any future administration will be how successful you are as individuals and as a group. Because, I want to be very blunt about this, nobody is going to listen to people who are not successful, wherever they are. And that is as good as they can get. The reason why we listen to Obama is because he is the president. All right? So every time he comes to Kenya, if he wants to see Kibaki, you see Kibaki. The reason why you will also at some point come and see Kibaki if you want is because you are a successful person. So your success here in Boston and also in the United States is very crucial for yourself. It is very crucial for the Kenya government. And it is also crucial for all of us because the influence that you will have here is what is going to create your importance in Kenya.
Okay.
The reason why the Jewish community, American Jews are very important is because they are so influential that they influence the American government. When you can influence the American government, you'll be very influential in Kenya. Thank you.